they need not to worry, because as I mentioned, we are going to sit down with the Treasury and make sure that we continue funding support to those patients who are receiving ARVs, those patients who are on malaria treatment. The nets we must continue distributing the nets. So it's just a question of now changing or adding additional resources through the National Treasury, as opposed to where we are relying on the development partners. Yeah. We take note of that, and our teams are already working on the impact of that order to our healthcare system, and that we'll be able to come up with an assessment of how much then we need to invest, to put into the healthcare system in our supplementary budget and in our subsequent budgets that will be coming. So that is just a notice to us. I can call it a notice to us that we start looking at our budget and funding to these very crucial sectors, especially the HIV and TB, malaria, which are three common, very, very dangerous diseases that we are facing here in the country, and we need to invest heavily. We have gotten that support for a long time, and you still want to appreciate for that support. Now that they have given us that order, we have to look at our budgets and see that the services continue. Those people who are on ARVs must continue receiving their ARVs. So that's why my team is working on the impact, and then we'll be able to have an engagement with the National Treasury for additional funding to those sectors. The issue is the drugs are available, and we are getting the support because we are funding through PEPFAR. So we have to continue buying the same quantity of our patients, because we know we give ARVs to about 1.4 million Kenyans, and therefore they must continue receiving their ARVs. So it goes, we are getting almost like it was 60-40 ratio. So therefore we have to cover that ratio that now we will not get the funds. No, 60 USAID, PEPFAR, 40 government, because we used to have what's called counterpart funds that we are providing. So we are bringing this standard here so that we start ensuring that we improve our quality of care, as we all talk about ensuring that we have access to quality health care. And it is enshrined in our Constitution. Article 43, subsection 1A specifically talks about that. So the only way we can now ensure that we comply with that article is to have this kind of standards. And I'm very happy that most of the facilities, both private and government, have come here today to learn, to be taken through the procedures that can help them attain this ISO 7101 2023 standard.
This particular standard, ISO 7101, is a 2023 standard. It's a new standard specifically for the healthcare systems. We have had other management systems like ISO 9001, which quite a number of the hospitals and healthcare sector has taken up. There are more advantages of this particular management system because it is specifically for the healthcare. The others normally improve the management system within the institutions, but this particular management system is for the healthcare services, and therefore it speaks to what is required to bring the efficiency and operational efficiency within healthcare, as well as to transform what the country is looking at.
Can you imagine what you're telling me? How to improve service in sector, a perfect fit for public-private sector partnership. A retired doctor in one of our leading hospitals, specifically just mentioned, Kenyatta National Hospital, came to that idea of saying we do not have the budget will not be there in our healthcare system, and specifically the that calibration. As long as it's functioning, it is okay, it's not bad. But you see, it is required to be calibrated for the purpose of giving us access that came into effect in 2010, our constitution. The issue is access to quality. So Kenyatta, I want to applaud you again because you served I think the highest number of visitors that come to. And I believe with this standard now, you are even going to be better, you are going to improve. Because that doctor who came to me said that we need order in Kenyatta. That in the event of any emergency, it's very difficult, especially as we are saying, if you go there around 1 when they are visiting during this workshop, is calibration of healthcare stroke medical equipment. This area is an area that has been neglected for a long, long time. But the only thing of care bill, now we are saying we want to entrench it in law. So it's not just going to be something that we talk about. It is going to be entrenched now in law. So very soon my state department is going to prosecute that bill so that we are all using the same national stroke. That is a national referral hospital that all of us describe the right management for that particular disease. So our patients are now going to be better handled and improving in our quality of care. Thus, you're bringing me the theme of this workshop, production system, Mr. Tiachi Ono, who said that, I quote, without standards, there can be no improvement.